be explaining the different sizes of needles that we use. And we can start with this one. This one right here is for an IM injection. I'm going to open it so we can see. And this one is 3 milliliters, which is usually about the size that we use for IM. And here we have the needle, which has to be inserted still, it comes separately. And this is a 21 gauge. And we remove this blue thing. Right here, we don't take the top off yet. We first put it in, and then we just pull it out straight, not at an angle, just straight out. And then this is a pretty thick needle. We usually don't recap, but you can if you just pulled out medication. And this is 21 gauge, and it's pretty thick. And we'll compare it to the intradermal, which is right here. And this is a 27 gauge. And if you see, it's actually a smaller part right here too. This is 1 milliliter versus, so if we pull out 1 milliliter versus 1 milliliter, it's a big difference, but it's the same amount. And this needle is a lot smaller. And we're going to put it up against this paper. You can see that one versus this one. And the bigger the number, the smaller the needle. So this is a 27 and this is a 21. And even though this is 27, it's much smaller, much thinner than this 21 gauge. Okay, we're going to recap just for this demonstration. And we have this big one, and this isn't used to give injections. This is used just for saline flush, if you're going to flush an IV line, or if you're drawing up medication such as morphine, which has to be diluted. Okay, and then you can attach a needle if you want to, but usually this is an IV port right here, used for INT, which is intermittent needle therapy. And then you take this top off, and you would put it onto the catheter. It's until you get hooked up to an IV. And in this part of this INT, you would insert this with a needle. And this is 10 milliliters, so that's how you know you're not going to give a medication that's 10 milliliters. So that's all.
And I will be showing you about insulin syringes and drying it up in vials and ampules. So, what we have here is alcohol prep, insulin syringe, a vial of insulin, and an ampule. With this insulin syringe, it's very special and different from other syringes. 3 reasons why is you'll notice that it's orange capped. Another reason is that it's always in units for insulin. Units is different from milliliters and cc's. However, 100 units of insulin is equivalent to 1 milliliter, about 1 milliliter of whatever you have in. But we never convert milliliters into units and units back, vice versa. So that's the second reason. And another reason that an insulin syringe is different is a non-removable needle. This cannot come off. So the 3 reasons again: orange, in units, and non-removable needle. Now I'll be showing you how to draw up some insulin. First, observe your vial. If there's already a cap on it, if you just popped it off, you don't have to worry about cleaning the port site. However, if it's already been opened, we will clean off with this alcohol prep. When opening up these alcohol preps, you want to tear it in the middle, and it's so much easier to get your alcohol prep. So I'm just going to wipe it here. Good enough. And then, depending on how much I want to draw up, I'm going to make space available in this syringe before I draw it up. So let's say that I want 50 units of insulin. I'm going to draw up 50 units of insulin, of air, and then push it into this vial first. Now, I will be able to draw up 50 units of insulin by turning it upside down. I want to be able to see it myself, so I'm pointing the label away from my face and drawing 50 units. Now I can go a little bit further beyond 50 and go about 60 and then, but make sure that I push 50, push it back. This is to make sure I have an accurate amount. So, and when you think you have 50, pull it out. Hit it a couple of times to make sure there's no bubbles. And then, recap, because I'm gonna give it to my patient. I wanna ask somebody else, what do you see here? Do not tell them, do you see 50 units? You tell them, what do you see? And then they can accurately tell you, I actually see 49. So they don't have that idea that you're supposed to have 50. Now another drawing up method is an ampule. These are specially designed for one-time dose, so once you open it up and use it, you will not use it again. And I'll bring it down. And to open this, you can take an alcohol prep and break it. Pow! Now I use this alcohol prep wrap so I can protect myself from any scratching myself. And what's nicely designed about these things is you don't have to worry about it falling out because of the concave design. Notice that none of the medication is falling out. Now, for drawing up the medication, don't worry about air. Just pull up the medication and you just put it about there. You don't want to put it all the way in or else you might cause some of the medication to draw up, to fall out. And then you can pull up your medication, how much you need. Da-da-da-da-da. And that is how you draw up from an ampule and a vial with needles.
Now see if you can answer these questions.